Today we're going to talk about men's health. Men's health, what many consider important only when they cannot go to work or when sex is not the same. In the 1900s, women outlived men by an average of 2 years. That gap widened to 7 years in the 1970s to the 1990s. Advances in diagnosis and treatment, as well as heightened awareness of the differences in men's and women's health, led to a narrowing of the gap to slightly less than 5 years in 2014. Still, a concern, however, is the high number of men deaths that are potentially avoidable. Many factors are contributing to the difference between men and women, but the factor thought to have the most significant impact on the health of men relates to the male gender identity, including a tendency for risk behavior. Not having a defined medical provider may be an issue for many men to seek medical care, as men's health lacks the same type of clinical focus as a women's health. It does not have the equivalent of a gynecologist to provide care for the reproductive tract of men. The care of the male reproductive tract is assumed by primary care physicians, urologists, endocrinologists, reproductive specialists, and sometimes even oncologists. This actually makes it more difficult for men to feel identified with a particular medical provider. The review of the leading causes of death amongst men demonstrates that many could potentially be avoidable. For example, the third leading cause of death for a man is unintentional injuries. Unintentional injuries can cause substantially more deaths among men than women, for whom it is the sixth leading cause of death. Suicide is the seventh leading cause of death among all men. This cause of death is not included even in the top 10 causes for women. In addition, homicide is among the 10 leading causes of death for men in certain ethnic minorities. Several of other leading causes of death among men are associated with chronic diseases like cardiovascular disease, for which modification risk factors and early detection can improve outcomes. An increasing amount of research is supporting a relationship between men's risk for the disease and death and male gender identity. The traditional male role has been shown to make it difficult to foster healthy behaviors. Male gender identity is related to a tendency to take risks, and this begins in boyhood. In addition, boys are taught that they should be self-reliant and independent and to control their emotions, and societal norms for both boys and men dictate that they maintain a strong image by denying pain and weakness. This is not helpful when we're expecting men to manifest certain symptoms. Men's predilection for risky behavior is reflected in the high rate of unintentional injury, which accounts for 6.8% of deaths among men, compared to 4% for women. Substance misuse plays a significant role in both risky behavior and the development of chronic diseases. Among adults, substance misuse continues to be more prevalent among men than women. In general, men are reluctant to seek health care or talk about their health because they see such help seeking as a sign of weakness or vulnerability and a threat to their masculinity. Data on utilization of healthcare resources indicates that men have fewer healthcare visits, including physician's office visits, emergency department, or home visits, than women. In 2017, 15.2% of men had no healthcare visits compared to 13.3% of women. In addition, men are less likely to have a usual source of health care compared to women. Women, in 28% of the cases, have a usual source of health care versus 14% for men. Men's beliefs about masculinity and traditional male roles affect health communication, and healthcare providers should consider male-specific beliefs and perceptions when communicated with male patients as well. This is an extremely important part of reaching out to men so that they can actually take care of their health better. So these are the 5 things I want you to remember about men's health. First, there's still a gap in the lifespan of men and women. Second, establishing a relationship with a healthcare professional is essential for proper care of men. Third, men have more avoidable deaths than women. Fourth, there is an increased risky behavior among men. And 5, masculinity and traditional male roles affect health. So it is perhaps time to change those views and beliefs about the masculinity and start working more towards a healthier group of men.